All right, this is very important. We'll get back to the inconvenient family discussion in a minute. But Dr. Robyn is on the line. Hey, Dr. Robyn, how the hell are you?
I'm very well, and you guys?
Good. Are you in your practice at the moment?
Yes.
I can see you wearing your mask and everything.
Yeah.
Ooh, there's a model of breasts at the back there.
It's a bust of a pregnant woman. Very nice.
Yeah.
So, Dr. Robyn, I asked you to do a little bit of work for us this morning. I forced you to watch a Cardi B music video called WAP, which stands for Wet Ass Pussy. And the reason I did this is because Sia and Flax came on the show this morning, and they were talking about, Sia was saying how much he is addicted to the song. It's like an earworm, and once it gets into your head, you walk around the house singing the song. Now, that's all great because Cardi B is a musician. But if a woman had a condition where her genitalia were producing such an excess of fluid that if she opened the front doors of her house, water would pour out, water in inverted commas would pour out. Is there a condition that women suffer from that could be equated to this music video?
Not in very positive light, and not in a light that you'd like to sing about it.
Okay, so tell me what that condition is, and if you've experienced anything similar in the work that you do as an obstetrician and gynecologist.
Well, so there are two options, and the one is either she's pregnant and her waters have broken.
Okay.
Yeah. And
I don't think that was what Cardi meant, though.
No, this is what I'm saying. There's a lot of things that it could be that really don't relate to anything positive or
all right.
Or
so if it isn't the water breaking, which we know is what, amniotic fluid?
Yes.
Okay,
yes.
So that's when a woman is very heavily pregnant and she's close to giving birth. Then what happens is that her water breaks.
Yes.
And this is that fluid.
So that's the one option, that we can have a big gush of water and it can spill off the bed onto the floor and have fun and games.
Sia, try to maintain your composure here, Sia. This is very much an anatomy and physiology conversation.
It's just words like gushing, and I'm certain I'm giving 3 minutes before we mention moist. But as you were, Doctor.
Go on, Doctor.
The other option is that there is a fistula, so a communication between her vagina and her bladder, in which case she has no control over her urine because it leaks out of her vagina. Generally, it's not quite in those volumes, but it's a consistent wetness that these women experience. It's often as the result of a very complicated and difficult labor and childbirth. Or sometimes it happens because of surgical mishaps in theatre.
A fistula.
A fistula.
What sort of surgical mishaps, Doctor?
Sometimes when something like a hysterectomy gets done, when we remove the uterus, there can be damage to the pipes between the bladder and the kidney, and they can then attach to or connect to the vagina, and then they leak directly. Urine leaks directly out.
And what is that bad for the vagina in the long term?
Well, we fix it. So
yeah, but if you weren't around, that could be a problem.
Yeah.
All right. Is Cardi B possibly suffering from any other kind of condition or infection? Is there a chance that this strange behavior that the vagina is displaying, that this might be as a result of something else?
I really can't think of anything that would result in such a volume of fluid.
Sure.
Yes, to need a bucket and a mop.
Yeah, like I said, I think there's an issue with the plumbing in the house, not her vagina.
Yeah, because she does have a bucket and mop in the music video too, to be fair. All right.
Yeah.
Wow.
I have a good everywhere.
What do you think she's hinting at, though?
She might be hinting at something like a vaginal infection, something like a bacterial vaginosis, where it might sound that it's nice and damp and moist.
Yes. Great words.
but it really isn't.
Okay.
It's just about, being aroused and having a lubricated vagina. Isn't that something to celebrate, though, Doctor?
Sure. I love that those words came out of Sia's mouth. But yes, tell us, Doctor. Is it ever possible for a woman to be so aroused that she might have this kind of effect?
Well, you might have to get John T on the line to chat a little bit more about squirting.
Squirting orgasms, right? Yes.
Maybe that's what Cardi means. But surely the volume that she's talking about there is just outrageous, and it must be as a result of some problem.
Exactly. I think even John Tierney's models would be impressed.
Well, you know, this is why it's so great to have you listen to us, and we can just call on you to help us figure out the mysteries of physiology. And
absolutely. And I have to also just say, I'm always thrilled to come on and represent East London.
Yeah, well, that's a very important part of what you do. So, Dr. Robyn, how are things going during stage 2 of lockdown? Are you managing over there? What's happening in East London?
Yeah, we had our peak shortly after Cape Town had its peak, and it looks like we're starting to see some improvements in our numbers, and wards are slowly starting to reopen at our hospitals, so we can get going with some more work again, which obviously has been a little bit slow for those of us that weren't on the front line of in the COVID wards.
Were you supposed to cut down on the amount of work that you were doing because you couldn't take up hospital beds? Is that part of the reason that you weren't able to practice at full capacity?
Yeah, so we weren't able to do elective surgeries. There were at my hospital there were 24 beds for elective surgery shared between 18 different specialists.
Sure.
So it was very challenging. We could do time-sensitive surgery, but not a lot else. And then, so slowly we're trying to get back to some kind of a new normal. So,
right. Dr. Robyn, what made you become a gynecologist? Because, like, it's not, they don't really say at school, hey, you guys want to look at this, become that.
So a lot of my motivation was I got through med school and realized that sick people and I didn't really have a good relationship. I didn't really enjoy dealing with the sick. I didn't enjoy dealing with the dead and the dying. I wanted healthy patients. I realized I had some talent in surgery, and I really didn't like male patients. Apologies to you lads.
Male patients are a pain in the backside of.
They're not disgusting.
Revolting.
I've heard from every wife and every mother and every girlfriend in the world will tell you that the most annoying thing on earth is a guy with man flu.
Who specializes in the male genitalia then?
Urologist.
Well, that's a urologist. Bizarrely, that was a subject I also quite enjoyed. The subject, I didn't enjoy the patients.
Okay, so Dr. Robyn, let's just help Flax and other people who are not sure here. Yes. You get gynecologists and obstetricians. That's what you are.
Yes.
You get urologists who deal with the male organ, but also the
urologist also deals with the kidneys and bladders.
Kidneys, correct. So
urologists and us actually work quite closely together on female bladders and things.
Right. And then you get a proctologist. Tell Flax that they deal with.
So they deal with bums.
What? The asshole. Towels and stuff.
Yeah. Cancers, fissures, etc.
What would make you want to do that?
Yeah, it's special. It's a special field.
Special.
I've always wondered, that question that Flax just asked has got to be one of the great mysteries of the world. Is what makes someone decide, okay, so I've studied medicine, which we know, Robyn, it's hard, right? I mean, stupid people don't get through medicine. It's too difficult. And you then decide, okay, well, now I'm going to specialize. So I've got this range of different things I could specialize in. I could become a dermatologist. I could become a cardiothoracic surgeon. I could become a neurosurgeon. I could become an ophthalmologist. But instead, no, I think I'll focus on the asshole.
You can pick them out at med school.
You can? What kind of people? Give me some stereotypes here that you identify early on in a proctologist.
Oh, it's gonna be nasty.
No, go ahead. I'm sure if there is a proctologist listening to us now, they will defend themselves.
Well, so first you get the general division into surgeons versus physicians. So surgeons deal with things that you operate on, and physicians deal with diseases that you treat with medication. Gynecologists and pediatricians sort of sit somewhere else. And then in terms of surgery, you get the guys that are going to be what's called a general surgeon, a trauma surgeon, a proctologist will come into that. So they're generally the guys that become quite passionate about their bowels. And
passionate. We're having a mature conversation.
It's so weird. I'm having my birthday next week. I'm feeling like I'm getting older every day, but I've never had a conversation with anyone who was passionate about the bowels. It's a funny thing, that.
Yeah, no, look, there are some special people out there. I do remember one of my profs saying, all patients must eat and all bowels must move. Yes.
Put that on the back of a sugar packet.
Exactly.
That is profound.
So here are some comments from other people on what you've just said. So first of all, does the doctor, and you remember we spoke about some bizarre names that people come up with.
Yes.
You're obviously in the room when they, the parents are thrilled, they've had a baby, and thank you, Dr. Robyn, and then you hear what the name is and you're horrified. So do you expect an influx of babies called Quarantino and Covenique? That's from Woody.
I'm expecting them. I think they're going to be a little bit more prominent in Cape Town, possibly, than in the Eastern Cape. Yeah.
Okay.
Has anyone named a baby after you?
I have had some Robins, but sometimes there's been other reasons, like there might be an aunt or a sister or a mom that herself uses the Robyn. And they do say to me, well, you can take credit for it too.
Yes.
Okay.
What's the biggest baby you've ever...
5.5 kilograms.
Wow.
Ooh, at birth?
Yeah.
How
That was not a vaginal delivery.
I was about to say that has to be a sunroof option. That
my biggest vaginal delivery was a 4.98 kilograms.
What sort of circumference does that equate to?
It's big.
Cool.
Hell of a baby.
My ruler here.
Jesus. Dr. Robyn, here's a suggestion from Carl. I think this is brilliant. Can you please suggest to Dr. Robyn she renames her practice the Department of Labor?
Yes.
That's great. That's terrific.
That's not a bad option.
All right. Well, thank you for making time for us this morning. It's always good to check in with someone who actually knows things instead of the bullshit we talk about every day. And we'll see you soon.
Cool. Thanks for having me.
Thanks, Robyn. Cool.
Cheers, guys.
There's Dr. Robyn, live from her practice in East London, where she's busy.
The Department of Labor.
Yeah, the Department of Labor.
She's really cool.
She's fantastic.